Hi, this is Mary Jadloc, and I'm going to discuss the health impact of mukbang. What is mukbang? Mukbang is a Korean word which means eating and broadcast. This word is originally from South Korea that was trended in late 2000 when a mukbanger eat a large volume of food in front of her viewers. So what's the impact of mukbang? Since mukbang, we're consuming a lot of caloric intake in one sitting. Imagine that your stomach is trying to accommodate the massive volume of food in one occasion, causing a strain on our digestive system that causes indigestion, bloated, and discomfort. Repeated this several times, it causes stress that increases the lining of the stomach, which develop GERD and gastritis. However, the chronic impact of mukbang is gaining weight and obesity. So, how do we measure obesity? According to WHO, if your BMI or body mass index is greater than 30, you're considered obese. We also check for our central obesity, the waist circumference, to determine the pads. However, like what I said, when there's obesity, there's like excessive amount of adipose tissue that secretes adipokines that secretes leptin, interleukin 6, and resistin. In this discussion, we're gonna discuss per system the impact or effect of obesity caused by mukbang. Let's start with the renal and nervous system. Lep- High level leptin stimulates the sympathetic nervous system, leading to vasoconstriction and increased heart rate. It also activates the RAS or renin-angiotensin system that increases sodium retention in the kidney and promote inflammation, causing high blood pressure or hypertension. In the respiratory system, because of obesity, there's a fatty neck, which has an effect in our upper respiratory compression and restricting diaphragmatic movement, reducing the lung compliance, leading to OSA or sleep apnea or OHS. In the cardiovascular system, our liver excrete high volume or high VLDL or high triglycerides and low HDL, causing accumulation of fats in our vessel that is called arteriosclerosis, a buildup of plaque. Because of chronic inflammation and instability of this plaque, it can travel to the heart, which can cause MI or CAD or cardiovascular disease. If it goes to our brain, it can cause stroke. If it goes to the lower extremities, it can cause PAD or limb loss. For our metabolic disorder, dysfunction and insulin resistance, in the pancreas, because of the visceral fat, cytokines will be released, resulting in insulin resistance and high glucose in the bloodstream that causes diabetes type 2, which show the three P's: polyuria, polyphagia, and polydipsia in the patient. And the pancreas as well, since there's a hyperinsulinemia, the fatty acids will do hypogenesis, resulting fats all over the liver, causing steatosis, which is what we call a non-alcoholic fatty liver disease. Increased reactive oxygen species inflammation causes steatohepatitis if it has fibrosis and um, nodules, it becomes cirrhosis. Binge eating will be part of mukbang because of the addiction and cycles of overeating. The guilt as well, resulting in obesity, having a distorted body image, and unhealthy eating behaviors. My reflection to this, mukbang has introduced another factor of contributing unhealthy lifestyle, promoting serious diseases that affect multiple organs. Content creators risk pushing themselves hard to monetize video, and I hope will develop a healthy lifestyle. Thank you.